Hi everyone, thank you for joining me for this lesson on the pelvis, pelvic tilt, and we're also going to touch on open and closed hip postures. So as far as the pelvis is concerned, the important things to know is that the pelvis is like a bowl. It's comprised of three bones that have fused together. Those three bones are your ilium, so these are what we call iliac crests. You can actually feel the anterior superior iliac spine right here. You also have your ischium, and so some people will refer to those as their sits bones, or that's what you can feel kind of right in your bum area. And then your pubis bone, and that forms and comes together at an area called the pubic symphysis. So you have your pelvic brim, which is kind of the top of the bowl here. And then you have something called the pelvic inlet, which is this part of the pelvis. And then you have your pelvic outlet, which is actually the area where, for example, a baby would exit during birth. When we think about the pelvis, men and women generally have a little bit different pelvises. So a male pelvis tends to be a little bit more narrow with a smaller pelvic inlet and outlet, whereas a female pelvis tends to be a little bit more wide with a larger pelvic inlet and outlet, mainly for the purposes of childbearing. So as far as how the pelvis and anatomy of the pelvis pertains to yoga and your role as a yoga instructor, it's important to know what movements the pelvis can do. In this case, there are two main movements to know about the pelvis. There is something called anteversion and retroversion. So when we think about anteversion and retroversion, you want to almost think about the pelvis as a bowl, and the bowl kind of sits like so. So when we are doing things like dog tilt, kind of tipping that pelvis forward, that is anteversion. Ante means forward. So forward tilt of the pelvis is anteversion, whereas bringing that bowl back to kind of hold water in the bowl as opposed to pouring it out is retroversion. Retro means back. So you're tilting that pelvis back. Some people refer to retroversion as cat tilt. So anteversion, dog tilt, pouring water out of that pelvic bowl. Retroversion, that'll be cat tilt, and that is kind of holding water into that bowl. So in terms of the pelvic position during poses, everyone is a little bit different, but depending on how your spine articulates with your pelvis, how your hips fit together, and your general flexibility and strength, you might find that your pelvis feels better in a certain position than another person's pelvis. So one exercise that I love to have people do for this is to actually stand up and get into your chair. So take a minute to get into your chair pose. Now, when you're in your chair pose, and I'll go along with you here, when you're in your chair pose, your pelvis might sit in a position. And there's a concept in yoga called neti neti, where you actually can retrovert and antevert the pelvis to find a spot that feels the most comfortable for you. Now, in this instance, you might find that actually you're more comfortable in a chair pose where the pelvis is more anteverted, or perhaps you're more comfortable in a pose that has the pelvis more retroverted. I really encourage people to have their students explore that within their class. One way to remember neti neti is it's actually Sanskrit for not this, not that, or neither this nor that. So it's just kind of a reminder that not every position is going to feel perfect for a person, and they might need to make minor adjustments in their body to make that position fit their body and not the vice versa of that. So that's probably the most important things to know about pelvic tilt. Let's talk a little bit about hip postures. So let's remember we've got our kind of mini hip joints here. So you have your pelvis, which forms something called the acetabulum. That's the socket of the ball and socket joint. And then you have your femur, with your femoral head, that nice round ball part of your ball and socket joint. So as you might appreciate, there's a lot of movement in the hip joint, but there's also some restriction there because of the depth of the socket. And another reminder that our hip joints have a whole slew of ligaments, cartilage. There's something in there called a labrum, which is a ring of cartilage that actually helps deepen that socket a little bit more. So just remembering that the movement can be limited, again, depending on how one person is put together compared to another person. And a lot of these things are just genetic. We're predisposed to being maybe more flexible or less flexible than our peers. So as far as hip and the things that are important to know from a yoga standpoint, you may have heard of open versus closed hip postures. An open hip posture is when the hips are externally rotating, whereas a closed hip posture is where the hips are in a neutral position or slightly internally rotating. So as a review to our descriptors of movement that we've gone through previously, external rotation would be rotating outwards, opening that hip, whereas internal rotation would be rotating inward, bringing that hip in. And so different postures will feel better or make it easier if you have the hips closed versus open. Some examples of open hip postures that you might be familiar with include pigeon, warrior two, goddess, lotus, and triangle pose. Whereas your closed hip postures, you might be thinking more about mountain, warrior three, crescent pose, camel, and bridge pose. So poses where those hips are either neutral or maybe even slightly internally rotated. The interesting thing to think about is some poses are a little bit more nebulous in terms of whether or not they need to be open hip or closed hip. So an example that I like to think about is warrior one. Traditionally, people think about warrior one as being a closed hip posture and having those hip pointers, as people sometimes call them, pointing forward. Again, those hip pointers are your anterior superior iliac spine. So as far as those hip pointers and then the hip position itself, the femoral head in that acetabulum, with warrior one, if you stand up and do that right now, you might find with your foot positioning, with that front foot facing directly forward and that back foot kind of facing slightly forward and maybe out towards the front corner of your mat, you might actually notice that, gee, I actually am getting a little bit of slight external rotation in my hip. And that's normal. That's actually your body's way of adjusting for that foot position and the type of posture that you're trying to achieve in warrior one. It's actually near impossible to have a truly closed hip posture with warrior one. And in fact, it could be injurious if you really try to strain to get a closed hip posture, because remembering again that our hips have that nice ring of cartilage called the labrum, and you can actually injure or tear that labrum with certain hip postures that kind of bring that labrum into a position where it's not necessarily meant to go. It's not a particularly flexible piece of tissue. So as far as closed hip, I just encourage yoga instructors to be careful about when you're using that terminology and to try and make sure that students never feel pressured to crunch their hips into a certain position if they're meeting any sort of resistance or having pain with that posture. Now, on the flip side, let's think of some traditionally open hip postures. So tree, certainly an open hip posture, regardless of how you do it. You have your leg that you are not balancing on is open. Now, one thing to think about with tree, though, is traditionally we have encouraged people to try and get that leg that's up, pressing against the inner leg, or the standing leg rather, to kind of crank back so that it's it's kind of flush with the rest of the body. So for example, people bringing their leg up and then making sure that it's in line with the rest of the body here. But if you were to stand up and do tree now, and go ahead and do this as we chat, you might find that actually your leg, as it externally rotates, still has some anterior or forward motion to that knee. So rather, if you look down at your knee, you might notice that rather than it being a 90-degree angle from the front of you and the side of you, your knee's actually more maybe at a 70-degree angle, 60-degree angle. And that's okay, because as we kind of crank that knee back more and more, you actually can start to put strain on your SI joints where the sacrum and your pelvis meet. And that area can be prone to arthritis and other pain and dysfunction. So that is another position or posture where I really encourage instructors to meet their students where they're at, make sure that their students feel empowered to stop kind of cranking that leg back if they are meeting any resistance or discomfort, and really giving them space to explore the posture on their own and make it what suits their needs and their body at that time. So those are the main points about pelvic tilt and open and closed hip postures. As far as your yoga anatomy coloring book, the main thing to look at here is the pelvis muscles on page 96. And then if you go back to that axial skeleton and the appendicular skeleton, it will review some of the pelvis as well in there. So thanks again for joining me for this session, and we'll see you next time.